I'm Wendy, and today I'm going to talk to you about AIDS and HIV discrimination. What is AIDS and HIV discrimination? UNAIDS, which is the United Nations Program for HIV and AIDS, defines the stigma as a process of devaluation of people either living with or associated with HIV and AIDS. Discrimination follows stigma and is the unfair and unjust treatment of an individual based on his or her real or perceived HIV status. According to an article by BBJ Anderson in the American Medical Association's Journal of Ethics in December 2009, it stated that almost 30 years after the onset of the epidemic, HIV stigma and discrimination, fed largely by ignorance, persists and continues to have a forceful impact on those living with HIV. One of the causes of this stigma and discrimination is a lack of knowledge on how the HIV virus is transmitted. Half of the Americans, in a survey conducted by the Kaiser Family Foundation, still believed that you could contract the virus by sharing a glass with someone, touching a toilet seat, or swimming in a pool with a HIV positive person. Now, we know that that is not correct, and the survey also found that half of the adults said that they would be uncomfortable with someone HIV positive preparing food for them. 42% would be uncomfortable with a roommate who was HIV positive. 23% would be uncomfortable with a HIV positive coworker, and 35% said that they would be uncomfortable if their child's teacher was HIV positive. Now, as a healthcare worker, I was taken aback by these journal articles that stated that the stigma and discrimination is prevalent in the healthcare setting. As doctors and nurses, we cannot state that we are not going to take care of someone based on any kind of HIV or AIDS status. We are taught universal precautions, standard precautions, and we are taught to assume that everyone has some type of communicable disease, whether they do or not, and whether we know that they do or not. The Journal of International AIDS Society in 2009 found that Indian hospitals were letting family members of HIV or AIDS positive patients know their status without their consent. They were also burning linens upon discharge of HIV positive patients, charging only HIV or AIDS positive patients for infection control supplies, and wearing their gloves with any type of interaction, whether they were, having any physical contact with them or not. Now, this type of discrimination and stigma cannot continue if we expect to gain control of this HIV and AIDS virus. Um, this stigma and discrimination is keeping people and healthcare workers from being tested, for the virus, for fear of losing jobs or being segregated, kicked out of apartments, not being able to see their children because they have the virus. Um, Health providers interviewed in Zambia in a study were reported that medical personnel were looked at as failures in their community if they were diagnosed with HIV. Nurses in Thailand expressed concerns that their professional status would not give them the benefit of the doubt from their colleagues, whether they acquired their infection occupationally or through sex or drugs. That women with HIV violated their societal norms, and so they would be considered promiscuous. So, how do we go about eradicating this stigma in the healthcare facilities? We need to focus on individual, environmental, and policies. Individually, we need to increase the awareness, address the fears that healthcare workers have. Fear of acquiring HIV leads to discrimination. We need to re educate on modes of transmission and universal precautions, educate that there are many other infections and viruses that are much easily contracted than the HIV or AIDS virus. Um, Environmentally, we need to ensure that we have sharps containers, soap and water, and anyone who has been exposed to the HIV virus has, the post exposure prophylaxis that they need. Hand washing, hand washing, hand washing is the number one way to prevent infections. On a policy level, we need to make sure that everyone is on board to protect the safety and health of the patients and the healthcare team. Not only just the healthcare team, but everyone from the doctors and nurses to housekeeping and dietary staff. The only way that we are going to fight this discrimination and stigma is through education, education, and education. Only then will we be able to um, treat this epidemic and get it under some kind of control.